Hi, I'm Claire from Life Skills with Mrs. T, and today I've got again the lovely Xanthe Lukes, specialist nanny. Before we were talking about choking, but today we're going to look at allergies and introducing food and weaning, and kind of looking at the difference between food sensitivity, allergies, and anaphylaxis, because I do talk about anaphylaxis within my first aid training. So yeah, Xanthe, what advice do you have to give when it comes to weaning and allergies?
Well, I think the important thing is to wait until their gut is ready at 6 months sort of age, and be very careful about what you introduce in the first year. So the first year is really all about the milk,
Yeah.
but introducing the food to encourage taste and texture, strengthen the whole jaw and encourage speech and language as well. But I introduce things very carefully. So it would be certain allergens are very known about, and you might like to tell us what they are in a minute. But I would be concentrating perhaps on just vegetables, no salt, no additives, just pureed vegetables to start with, or softly cooked that the child could hold in their hand and munch.
Yeah, definitely. So your typical allergens would be wheat, milk, eggs, some type of soft fruit, so sometimes strawberries, kiwis, nuts, and seeds. I think anything that these are the most common ones that we see, but you can get the weird and wonderfuls. So it's always worth introducing. If you're going to introduce a food group, do it one at a time and keep a diary of how that child reacts to that food. So you could see some various different symptoms. So with food sensitivity, which tends to be kind of milk, you see this in milk quite often, like the griping, a bit of trapped wind, maybe some loose stools, and that's something to keep an eye on. But the allergy is something different. With allergy, you tend to get things like you might get flushed skin, you might get a rash that appears, maybe some vomiting after a food, and it depends on how quickly they vomit after the food to how severe the allergy might be. And I would always say with allergies, it's keeping an eye on it, and if it happens once, it could be just a one-off. If it happens again, then it's that question, okay, is this, and we've recognized the food that it's happened, then I would recommend going to see a GP. Yeah, so anaphylaxis is slightly different. Anaphylaxis is just where your system is completely overwhelmed by an allergen. So I would say if a child is struggling with their airway, so their airway, is all swelling and becoming blocked, and they're struggling with their breathing, that's when you need to really think, okay, I need to sort this out. I need to sort this out now. But generally with allergies, we've got time to go and talk to a professional. So yeah, any other advice that you would give, Xanthe?
Well, I think that's very reassuring to understand that there are different levels of concern. Just to say, if it was anaphylaxis, that would be a 999 call.
Yes, that's very true.
Otherwise, it would be a doctor's call, or if it's just a grumbly tummy, then maybe just take that food away out of their diet for a few weeks, but don't be scared to reintroduce it. Keep going with these things.
Yeah, definitely. I think, it's important that they can have things little and often. So when it's like a food sensitivity or allergy, but it's always worth getting professional advice from a GP or dietitian.
Yeah. I think parents worry about the allergies more than they need to, but it's always a good idea to introduce a new food earlier in the day, so perhaps more at lunchtime or even mid-morning snack rather than at bedtime, simply because if there is a grumbly tummy, if it does produce wind or something like that, it's kind of all dealt with before bedtime. It's not going to upset their sleep pattern as well.
Definitely, because a baby that doesn't sleep means parents that don't sleep, and that's never a good combination.
That's not good. Not good.
So no, that's a really good tip. Thank you for that. So yeah, so that's our brief chat there on allergies. But if you want to know more, then visit xanthelukes.co.uk. And if you want to know more about how to deal with anaphylaxis, then I do talk about it as part of my baby and child first aid awareness course, and you can find out more at lifeskillswithmrst.co.uk. So thank you ever so much for chatting with me today. It's been great to talk about food and allergies. And stay safe, guys, and look forward to chatting to you all again. Bye.